All right, so let's get started for the day. Hello again, everyone, and welcome to the Research Overview webinar. I will give you a moment to read our distribution notice. And with that, welcome. My name is Nikki Hogan, and I'm joined by my co-host, Zach Revis, and we are both technical services representatives on the research informatics team here at EPIC. And today, it's our pleasure to give you the overview of research-related functionality in EPIC so that you have the big picture to help guide your organization, whether you're in the early stages of your implementation or if you're looking to optimize a live environment. During the webinar today, there's a couple of ways in which we'll communicate. If you have a specific question that you want us to answer, please do use the Q&A window. We'll stop at regular intervals to address the questions that have been coming in. Do note that Zoom also has a chat feature, which we won't be monitoring as closely. So if you do have questions, please try to throw them in the Q&A so that we see them. Additionally, we are recording this presentation. A copy of that recording, as well as a copy of the slides, will be available by the end of the day on the user web in the same place where you went to register for this webinar. So when we talk about the big picture of how EPIC can support research, here are the broad areas that we think about: feasibility and cohort exploration, study execution, evidence generation and analytics, innovation, and collaboration. During the webinar today, we're going to focus on the first three areas, and we'll also touch upon some ways that you can connect with the EPIC research community, as well as some foundations for successful feature implementation. Let's start at the very beginning. Often the first step for many research efforts is understanding your own population and how it fits with the needs of the study. This could come in the form of identifying a study cohort prior to study approval, or identifying patients after approval for recruitment. One tool that can be extremely useful for exploring the patient population is Slicer Dicer, EPIC's self-service cohort exploration tool. Slicer Dicer can be really useful for researchers to get a sense of the patient population at your organization and how many might fit the needs of a given study. At a basic level, end users can interact with the tool by applying various filters on the right-hand side, which then filter and divide the patient population, which is visualized on the left-hand side. Information displayed here is summary level, and it's shown in a variety of types of graphs, including bar graphs, as well as line graphs, tables, or even geomaps. Additionally, Slicer Dicer supports some basic statistics tools such as averages, standard deviations, and percentages. Summary information is useful, but once your study is approved, you might need access to line-level information to start with recruitment, either directly in Slicer Dicer's detail table or exported to a spreadsheet or reporting workbench. For those users, you can require them to enter an IRB number by giving them a specific analytics security point. Your users will then have access to this selection window, where they'll select from a list of IRB-approved studies that you've entered into EPIC. And you can also decide whether you want to allow free text as a backup option. If you don't allow free text, these users will only be able to export results if they are a user or provider on an IRB-approved study. You can then audit the users reviewing line-level data for research purposes if you need to. To guide us through the presentation, we'll use this high-level research workflow diagram to organize our thinking and conversation. We'll touch on each of these items as we go through the rest of the presentation. So once you've decided to take part in a study and gotten it approved, the first thing is that your EPIC environment needs to know about the study. A research study record contains general information about that study. This includes things like the NCT number, the study status, the study type and area of research, a brief description, the PI and study coordinators, and numerous other study level attributes. This includes places to configure functionality such as recruitment and research billing, which we'll both discuss later. Additionally, many of the features we discuss can be set up at the system level. but you can override those with study-specific settings, which are also located in the study record. Research study records are accessed within hyperspace in the Research Study Maintenance activity. In the study record, you can track both the billing status and the study status. Billing needs to remain open for a study until all charges are generated for patients that are enrolled. However, this might be after the study itself is completed. Having these two statuses be independent allows your study team to mark the study as completed without affecting billing. Study team members and administrators can use various reports and dashboards to group studies based on that study status. Additionally, you can define which study statuses are considered active in recruiting to ensure that recruitment tools in Epic are only used when a study is recruiting patients. Another section of the study record allows you to check IRB approval information, including the approval number and expiration dates. Your coordinators can then use a dashboard component in order to see at a glance which IRB approvals for their studies are going to expire soon, so they can take action. When working with study records, there are a number of considerations that you need to keep in mind. Chief among these will be who is responsible for the creation of the study record, in which environment should they create it in, and who will maintain it over the lifetime of the study. Now that we've got our study built out in Epic, we need to start recruiting patients for that study. Do note that while Epic has some great tools to help with recruitment, it's not a required workflow component, which is why you'll see it connected by the dashed lines. We like to think about recruitment strategies as a spectrum, from broad spectrum self-referral strategies to a bit more targeted outreach strategies to in-person at the point of care. Any given study may use one or more of these strategies depending on the needs of that study. Starting with the most focused approach, one method of identifying potential study participants is utilizing best practice advisories, also known as BPAs. These alerts notify providers of potential matches directly in the visit workspace and foster communication regarding the study between the provider and the patient. From this point of care BPA, the provider can update the patient study association depending on the patient's response, such as marking as whether they were interested or if they declined participation. The alert then automatically notifies the study team of the patient's response via in-basket, so they can follow up. Recruitment BPAs can be configured to be shown to the provider as seen in this screenshot, or alternately, they can be silent BPAs, which will send that in-basket message to notify the study team of a potential match without the provider seeing or interacting with the BPA. These BPAs are built on a study-by-study basis. Zooming out a little bit to the targeted outreach strategy. Points of care recruitment is nice when patients are coming in for visits, but there's power in being able to do outreach even when they aren't. You can send recruitment notifications directly to patients using MyChart. Someone on the study team will identify a patient population that matches the study's inclusion-exclusion criteria using a reporting workbench report or slicer dicer, and then can send them a MyChart notification directly from that report. As a patient logged into my MyChart account, they will then see an easy-to-understand study name and description, as well as some links to materials to find out more about the study. Once the patient has made a decision about whether they're interested or not, they note that directly within MyChart. The study team is then notified of the patient's response via in-basket and can leverage the updated patient study association to plan for next steps, such as looking into when the patient is coming in next so that they can speak further about the study. If the patient decides that they're interested in a study, you can configure a set of pre-screening questions that they can answer directly from MyChart. The study coordinator can then review and report on their answers to help determine their next steps. If the patient doesn't have a chance to respond in MyChart, the coordinator can document their answers directly in Hyperspace when the patient next comes in for a visit. Patients can also set the recruitment preferences in MyChart. They can indicate whether they would like to be contacted about research opportunities with your organization, and they can indicate which specific areas of research interest them. Your research users can utilize this information to drive their recruiting workflows, and the patient's preference regarding being contacted can be respected in both the BPA and the MyChart recruitment workflows that we just covered. Regardless of the strategies used for recruitment, there are some common general considerations that are not technical in nature, but are critical to your adoption and success with these features. Specifically, there's governance, process, and resource considerations that will be different among organizations, some examples of which are listed out here. And this is by no means an exhaustive list. Due to this, our strong recommendation would be to think big, but start small. And with that, we'll take our first break for questions. As a reminder, if you have a question, please do throw it in the Q&A so that we can address it. All right, so I'm not seeing any questions, but if you're still typing or you think of something while I'm talking, do throw it in the Q&A and we'll address it at the next question break. Once you have the study record, you then need to know which patients are associated with which studies. This is done through the research studies activity in the patient's chart. Using this activity, you can identify which study the patient is associated with and what their current enrollment status with that study is. The status list is something that your organization can configure. Additionally, each status will also be bucketed into one of three higher level buckets: pre-consent, active, and inactive. These higher level buckets can be used in a variety of places to configure reports and research features to only consider patients that are actively enrolled in a study. Once you have associated a patient to the study, information from the study record, such as the PI, coordinator, and study description, is now available directly within the patient's chart for quick reference. From this activity, your study team also has access to a number of pieces of research functionality, which we'll touch on later, including billing timelines, adverse events, and data capture smart forms. Users are able to access this activity across Epic applications, and access to it is controlled by research security points. The fact that the patient is a research patient is now visible in the patient's storyboard. If a user is interested, they can hover to discover to get basic information about what studies the patient is participating in, all without the user having to leave their usual workflow. This supports the concept of research-aware patient care in Epic. There are an array of tools to make the patient's research-related activity and care be known to those interacting with the patient. Research-related information in the patient's chart is marked by the interlacing hexagon icon to make it clearly visible to your users when care is research-related. This icon may be found in a variety of places, including the storyboard as seen here, but also elsewhere in the chart to denote research-related encounters, orders, and results. One large benefit of having a patient associated to a study is that if a patient is seen in the emergency department or the hospital, the study team will get a notification automatically via InBasket that the patient has been admitted. A key step in the enrollment of that patient is getting their consent. The study team members can capture the patient's research study consent document directly in Epic. Research consents have a specific research consent document type, and the specific consent document itself is linked directly and discreetly to the appropriate study in research study maintenance. Alongside collecting the signatures themselves, you can collect metadata, such as received by and expiration dates, as well as comments. What data you collect is configurable based on the needs of your organization. Once all of this metadata has been collected, signatures can be collected either directly in this window or by launching the consent on another device. One possibility for collecting the patient signature is via welcome tablets. In order to use this workflow, your organization must have tablets specifically configured for welcome. And there are multiple benefits to this workflow. First and foremost, it's secure and natively integrated, with clinicians being able to use a QR code from the consent activity in hyperspace to launch the consent on the tablet. Welcome tablets allow for a validation step, requiring patients to confirm their date of birth. And more importantly, your organizations are likely already familiar with the welcome consenting workflow, since procedural consenting uses the same workflow. Additionally, as your coordinator queues up the consent, they have the option to release it to the patient to instead sign in MyChart. Whether or not a consent is allowed to be released to a patient to sign in MyChart is configured on a per consent basis in the study record. Once the consent is released, a patient in MyChart is prompted on their home screen that there's a new consent available for them to sign. This will link to the document itself, which the patient can then review on their own time and electronically sign during a phone call or a telehealth visit with a member of the study team. We've already touched upon the first three items here as a benefit to the patient study association. Additional functionality that's dependent on the patient study association is Beacon protocol suggestions and restrictions, order study association, and research billing. As you start thinking about patient study association, you'll need to think about who will perform the initial patient study association, as well as who will maintain it as the patient progresses through the study. We've generally seen this be owned by the study coordinators. In the case where a study is an oncology study, the next step in the EPIC workflow is assigning a Beacon protocol to the study patient in the form of a treatment plan. Beacon clinical protocols can be linked to the appropriate study in the study record. If your study has multiple branches, you can also specify the protocol per branch to make it easier for your users to select the correct protocol for that patient. You can also specify if there are specific types of protocols that the patient should not be assigned to for the duration of the study. This can help prevent the patient from being put on a treatment plan that is not associated with the study or which might jeopardize the patient's participation. If a study is configured with study protocols and a treatment plan is being created for an active research patient, the system will automatically suggest the appropriate protocol based on the study configuration. When you create a treatment plan this way, it automatically associates the treatment plan to that research study. Not only that, you can link it to a specific amendment to make sure that going forward, if treatment plan updates are needed, it is clear which version of the treatment plan the patient is on. One of the largest upsides to creating a research-associated treatment plan is that all orders from that treatment plan are associated to the research study. We'll discuss specific benefits of order linking later. Once you know the patient is on a study, the next thing is knowing which encounters for that patient are related to that study. As a reminder, an encounter in EPIC is any type of contact with a patient, such as an outpatient appointment, a lab visit, a hospital admission, etc. Here are a few of the reasons why encounter linking is important. Not only does it help with transparency around research-related activity, that transparency can be harnessed in release of information workflows, tracking study-related visits for your study teams, research billing, and study monitor review. By linking an encounter to the study, we're also able to handle clinical plus research mixed visits by scheduling one encounter and linking it to the study, rather than having to schedule one visit for clinical care and a separate visit for research-related care. Encounter linking can be done during the scheduling workflow by selecting the appropriate study to link to in the registration activity. Alternately, study coordinators can keep an eye on upcoming appointments for their study patients to make sure that they're appropriately linked. If they see an upcoming appointment that didn't get linked during scheduling, they can link it directly from the report using a button in the toolbar. A major benefit to study teams for making sure research-related appointments are appropriately linked is that if a research-related appointment is canceled or rescheduled, the system will notify the study team. This can help prevent protocol deviations or even patient disqualification. Additionally, if you have patients with visits that require research-specific tasks to be performed, such as submitting case report forms or collecting a patient's consent, then implementing research study calendar tasks can help your research coordinators remember to complete those items. When a research coordinator creates a treatment plan or a timeline from a protocol for a patient, and we'll discuss timelines a bit later, the research tasks from the associated protocol are automatically added to the patient and are visible in a sidebar for easy reference. Your study teams can collect study-related data through custom smart forms for your studies. When you use smart forms instead of a third-party survey application, the data can be easily visualized across patients for your study using Reporting Workbench, or they can be extracted and analyzed in Clarity. In addition to smart forms, if you have a patient-answered questionnaire for your study, you can build that directly into Epic as well. In the study record, you can specify a questionnaire as well as an enrollment status for that questionnaire where it will be automatically assigned to the patient. You can then use this to both assign questionnaires that may only need to be answered once, as well as a questionnaire series. If need be, you can also manually assign study questionnaires to patients in the research studies activity. Once a questionnaire has been assigned, the patient will be able to access it within their MyChart and respond to the questions in their own time. If the patient doesn't have a chance to respond before their next visit, a study team member also has the option to launch the questionnaire from within Hyperspace to record the patient's answers. From the research study activity, study teams can access the adverse events activity to document the adverse events related to that study. They can attribute this adverse event to the study and document grade and outcomes. In addition, you can define specific medications, supplies, or procedures that you want to be available as an option for attributions, and you list those out in the study record. Once documented, coordinators can send these adverse events via InBasket to the PI for review. You can also build reports from a reporting workbench template to allow study coordinators, PIs, and other research users to review adverse events that have been documented for patients who are enrolled in their research studies. Additionally, study monitors would be able to review these adverse events in Epicare Link. Another feature that can help you keep your study-related documentation up to date is amendment tracking. By tracking amendments in Epic, your coordinators can identify patients who are affected by changes and ensure that those patients sign updated consent documents and receive modified treatment plans as appropriate. On the amendments form in the research study record, you can enter details for every amendment, including the version and a description of the change, which consent documents are updated, whether treatment plan updates are needed, and instructions for how to do those updates manually. When a user marks an amendment as approved, coordinators can run reporting workbench reports to identify which patients are affected by the changes. Additionally, they can then notify the users when the patient's consent or treatment plan becomes out of date via the research studies activity, treatment plan activity, or by a BPA. This allows for users to take action as the patients come in for their next visits. So with our patients coming in for research-related visits, we'll now go over how to link orders to that study. Linking orders to a study is done through the Research Association grid. When a patient is marked as an active research patient, a Research Association button will appear in the ordering workspace. By selecting it, we launch the Association grid. Only studies that the patient is associated with will show up in this grid, which may mean that there might be one or more studies available for a given patient. For users who frequently place research orders, we recommend additional configuration to include a Research Association button directly within their visit taskbar. Order linking makes research-related care transparent in the patient's chart for comprehensive patient care, and it provides context for that order. In the study record, you can specify which members of your study team should receive results for research-related orders. This works even if those study members are not in roles where they would receive the results as part of standard result routing schemes. This result routing depends on that order being linked to the study. It's possible to create a filtering role for my chart to handle results related to research orders differently if necessary. Again, this depends on the order being linked to the study. You may consider implementing this for sensitive studies, where certain lab or other information should not be available to the patient and their proxy via my chart. Within the context of ordering workflows, the contraindicated medications functionality helps warn clinicians when a patient is at risk of taking a medication that might jeopardize the patient's participation in the study or interact with study medications. Within the study record, you can select groupers of medications that pose a risk to the patient or the study, as well as set a severity and a custom warning message. These warnings appear both in Hyperspace and Willow Ambulatory in the same location as other medication warnings. And with that, we'll take a second break for questions. I do see okay, so one question in the chat, are there templates to work from the consent, or is this something you have to build from scratch based on the individual needs of the study? Zach, do you want to take this one? It looks like you typed out an answer.
Yeah, sure. So the question is really around how easy is it to reuse some of that consent configuration? And is there any other software that you might need besides Epic to get consenting for research off the ground? And so the reusability is going to vary. So if there's portions of the actual consent content, like say a header or a footer, that stuff can be configured in a smart text and reused across all of your consents. Obviously, the study-specific language is going to have to be created on a study-by-study basis. The stuff that was on the left-hand side of the screen when we looked at that consent, there was a bunch of data entry fields on the left. Those things are going to carry over between studies. So that part is reusable, but the actual, the text is going to have to be entered based on whatever text you might receive from a study sponsor that's been reviewed by your IRB and things like that. And then on the other side of the question there, is there any other software that you might need? There's nothing necessarily that you would need aside from Epic to do research consenting. I will say that a lot of groups sort of work research consenting into other consenting workflows, and there may be other software that your organization is already using for that. So I think that's maybe a broader consents conversation that you should have with the others, with the other IT folks at your organization. But in general, there's not any other software required.
Yeah, go ahead.
Yeah, I was about to say, another question in the Q&A here, do we have reports to point out visits that might need to be linked to the research timeline? We do have a report for upcoming visits, and we'll get to that a little bit later in the reporting section. So we'll wait for that to get a little bit more fleshed out there.
Yeah, looks like there's also a second question about consenting. So struggle building consents. Is there a way to make adjustments on alignment configuration when building e-consents? I'm assuming you mean actually lining everything up so that it adding margins and whatnot, which not easily. There are some quirks to the e-consent template editor that you just learn as you build more and more consents. If you have specific questions on a document that you're having issues building, do reach out to your research TS and they'd be happy to work with you on it and make sure that it matches what you think it should. All right, good questions, but I think we'll move right along and I will hand things off to Zach to go into research billing.
Yeah, thank you, Nikki. So next up, we'll talk through the research billing lifecycle here. To start with, we recognize that throughout your studies, there will be instances where study-related charges should go to the grant or a sponsor, and other times when they should really go to the patient's insurance, probably with a specific modifier. And there could also be both types of study-related charges during a given visit. So what you're looking at here is just a conceptual representation of that idea. And then how we've implemented that in Epic is with the study's billing protocol record, and that is built at the study level. This functionality enables you to indicate what gets covered at which visit of a study, and whether the charges would be covered by the study or by insurance with a modifier. Modifier types are mapped during claims processing and can be dynamic by payer. So for CMS, we convert to Q0 and Q1 modifier types. The billing protocol itself is a template that's plugged in at the study level. The way to make that template patient-specific is by applying a patient's timeline. After you associate a study with a patient, you can generate that patient's timeline, and that's the patient-specific version of the protocol that we saw on the last slide. It's important to avoid confusing this with a research study's calendar of events for a patient. Primarily, this is a timeline that enables the research charge routing logic engine to compare the service date of a charge against the appropriate visit of a study for a patient, based on either an explicit link of the encounter to that point on the timeline, so going back to the question from the Q&A just a moment ago, or based on the time window for that visit, so for example, within the first week of the study. So let's see what that workflow would be. When our study patient comes in for a visit on March 1st, charges might be automatically generated based on the services provided there, or an Epic user could manually trigger a charge. As charges come through from study-related encounters and orders, they'll evaluate against the patient's timeline and then look to that underlying billing protocol to route those charges accordingly. We'll review charges for our research patients and any pre-routing of those charges in the research billing review activity. To identify patients that need research billing review, study team members and billers will run a reporting workbench report to pull the list of patients. This report can be customized to pull in charges for only certain studies, billing systems, or other criteria, depending on the needs of your users. By default, it will show one line per patient study association that has charges needing review. Users can jump into the billing review activity directly from this report. For easy reference, a dashboard component can make it easy for them to see at a glance when they've got outstanding accounts to review. There are also ways of utilizing information like the study type to hone in on what qualifies for review. For example, if a study is purely observational and there are no anticipated study-related charges, you can refrain from qualifying those study patients for research billing review. You can also specify what charge modifications would require charges to go back through the research review process, such as a change in service date or the associated diagnosis. Charge review itself can be done from the research billing review activity. This is designed to be a central place for all study information needed by a research biller, so it's very detailed. We'll go through it section by section. In the upper left, we pull in information both about the study and the specific patient study association for easy reference. If there are billing protocols listed in the study record, those will also be available here as well, regardless of whether a timeline has been created for the patient or not. This allows billers to reference the protocol even in the cases where a timeline hasn't yet been generated. Also on the left-hand side, we can see a summary of the charges themselves. From this one activity, you can see information about hospital charges, shown in pink and with a hospital icon, and professional charges, shown in blue with a blue doctor's bag icon, as you see here. When a charge is generated, the system will assess where it should be routed based on factors like whether or not the charge is linked to a study or on direction from a billing protocol. There are three possible buckets a charge can fall into: study-related bill to study, study-related bill to patient, and non-study charges. If that initial assessment is incorrect, a biller can select the charges and do a research charge correction to move them to the correct bucket. For any research charges billed to the patient, a modifier type should be specified. That modifier type drives the Q0 or Q1 modifiers on the claim, like we discussed earlier. For any charges billed to study, those will be split off into a separate hospital account specific to that study. That hospital account is recurring on a monthly basis, and a new account will be opened each month for that month's study charges. Once a biller has finished their review and made sure the charges are all in the correct buckets, they'll mark the account as reviewed in the upper right-hand corner. At that point, the account will continue on with the billing cycle. Finally, if a patient has a timeline applied, and the protocol that the timeline was generated from will appear in the sidebar. This allows for billers to easily reference the expected charges for the visit and ensure that any pre-routing of those charges happened as expected. Any charges that don't match against the protocol will fall into the non-study related charges bucket by default, as do any charges for patients who don't have a timeline applied would do. Any charges in this bucket that may need to be billed to the study can then be research corrected to the right bucket. Let's take a moment to discuss the benefits of billing protocols. We still strongly recommend that all encounters for patients enrolled in an active study are reviewed, but using protocols will pre-route charges to the appropriate buckets as shown here. That can help improve efficiency of review for studies with billing protocols. It's important to note that with or without research billing protocols, you can use the research billing review activity to review and route charges. So to summarize, billing protocols can improve efficiency, but the review itself still needs to be completed. We encourage careful decision-making and analyzing scope and build effort for billing protocols. You can use the research billing functionality in Resolute PB or Resolute HB to automatically add modifiers and value or condition codes to claims based on the information that's captured in the upstream workflows we've discussed today. Some examples of this include the Z00.6 research diagnosis code, condition code 30, the National Clinical Trials number, and those Q0 and Q1 modifiers. And here we will pause for another questions break. All right, not seeing anything new come in, so we'll keep going. The next workflow we'll discuss involves allowing study monitors to confirm source documentation in the system using Epicare Link. Traditionally, you might have study monitors coming on site or being provisioned monitored access to hyperspace to accomplish monitoring tasks for your studies. In the 2017 release, we added functionality to allow study staff to release their patients to monitors using Epicare Link. There is a reporting workbench report and an accompanying action that study coordinators can use to release one or more patients at a time to a study monitor for a given period of time. That study monitor will then have the ability to review patient information using Epicare Link, with familiar activities like chart review and results review. To accomplish your research mission, you likely integrate with a wide variety of third-party systems. Epic is capable of interfacing information to and from many of these. One type of third-party software that's often key for research is a CTMS, or Clinical Trials Management System. We'll take a couple of minutes to talk about interoperability with those systems. Epic is interfaced with a range of CTMS applications using a standards-based interface profile that can be used by the various systems. If you're interested in interfacing with a third-party software, reach out to your TS to discuss whether your specific integration might be possible. When considering an interface, it's important to have a sense of the touch points between your CTMS and Epic. It's not uncommon for study creation to be done in the CTMS first, and it's often the case that the appropriate time for the study record to be created in Epic is when it's approved. Those records can be created through interfacing from the CTMS to Epic. Many organizations who populate Epic with study records also populate patient study associations through interfacing as well. In Epic, you may have implemented a workflow to track the pre-enrollment statuses for your patients. Because many CTMS systems don't track those statuses, it's also possible to send patient study association information from Epic to your CTMS. Finally, through an extended interface profile, it's also possible to bring over billing grid information. This isn't required, and some don't use the functionality in their CTMS, but it is possible to interface that into Epic. It's important to consider the charge data master and gain an understanding of how billing grids correspond with billing protocols in Epic before pursuing that expanded interface. Next, let's talk about evidence generation and analytics supported by the platform. Specifically, we'll talk about the use of Kokodo and how it can support research. A tremendous amount of data is being captured in Epic through end-user documentation, interfacing into the system, and more. All of the data entered into the system is stored in Chronicles. Chronicles is a hierarchical database that's optimized to allow for patient-specific documentation and general workflow execution very quickly. However, it's not the best structure for large aggregates and reporting. Data captured in Chronicles also includes information from custom build, like smart forms. We can also capture information provided by the patient in MyChart, either through the use of patient-entered questionnaires or personal health monitoring devices. For reporting over large patient populations, every evening data from Chronicles is extracted to Clarity, a relational staging database that has historically driven a lot of analytics. From Clarity, data is extracted nightly into a star schema data warehouse called Caboodle. This star schema is more user and performance friendly than Clarity. Another benefit of Caboodle is that through custom ETL libraries, you can add non-Epic data to Caboodle to allow for reporting with Epic and non-Epic data in the same data warehouse. The different reporting tools in Epic pull from different sources in this hierarchy, and each has specific uses. We've mentioned both of the most common reporting tools, Reporting Workbench and Slicer Dicer, earlier in this webinar, but here we'll call them out in more detail. Reporting Workbench pulls its data directly from Chronicles. This means it's great for real-time reporting. For research specifically, the patient's association to a study provides a search base that allows the study's team members to quickly identify their own patients. From one report, study team members have access to many of the tools we discussed today right in the toolbar. This includes updating the patient's enrollment status, sending recruitment messages, assigning questionnaires, releasing to a study monitor, and more. In addition to coordinators being able to report on patients enrolled in their studies, administrators and managers can also report on patients across multiple or even all studies. There are also reporting workbench templates for coordinators to be able to report on their patients' adverse events, see responses to data capture smart forms, and to find patients with upcoming visits to make sure those encounters are appropriately linked to the study. To keep all of these reports right at the fingertips of your coordinators, they can be built into components on a research coordinator dashboard, so that as soon as the users log into Epic, your study team members can see at a glance the overview of their study's participants. This ranges from seeing an overview of patients in the process of being recruited, to monitoring outstanding tasks still needing action, to identifying when billing review is needed. Each of these components links out to a reporting workbench report where users can view line-level information about each patient and jump into the corresponding activities to take action. Slicer Dicer, which we also discussed at the beginning of the presentation, pulls its data from Caboodle. This data isn't real time, but it does allow for reporting across your entire population quickly. Earlier, we discussed using Slicer Dicer for feasibility and recruitment, but it can also prove useful later on in the life of a study for administrators. The research data models in Slicer Dicer can be used to view the breakdown of all studies taking place at your organization, as well as the full population of the study participants across studies. Additionally, if your billers want to see a breakdown over time of the study-related charges that are being billed to the study versus to the patient, there are a variety of slices and measures that can be used in the transaction data models in order to analyze charges related to research. As was mentioned earlier, access to line-level patient information in either of these use cases is controlled by security. And here we will take another questions break. All right, not seeing anything come in, so we'll continue. Next up, let's talk a bit about collaboration. Our research community continues to grow, both in the United States and internationally. We hold an annual EPIC research conference called the Research Advisory Council during XGM in the spring. This is a great time for organizations to share with each other their accomplishments and initiatives. It's also a time for us as a community to discuss our development priorities and vision. You can find previous Research Advisory Council presentations on the user web under Events. Also on the user web, the Research Discussion Board feed is a great place to ask questions of other research users. Note that there's a separate Research Billing Discussion Board as well. So far, we've had an overview of our functionality and how various features can be used. But before you jump into implementing any of those tools, we want to take a moment to talk more generally about some of the foundations for success when using research in Epic. What we've learned over time is that functionality is not the most important thing to establish initial or ongoing success. First, you'll need to understand your own operational and organizational drivers to succeed. Here are a few examples. When establishing your own drivers, be sure to get to a level of specificity that you can act on. Rather than a generic driver saying that Epic should support research workflows, dive into some of the specific aspects of how you'd like it to promote research. Once you identify drivers, you can use them to prioritize which pieces of functionality to implement to help you achieve those goals. That defines the scope of your project. Those scope decisions affect workflow design. As you evaluate your current use of research tools, you might find that some current workflows don't need to change, but others might need revision, either because you're implementing new tools or Epic has updated or replaced pieces of your current workflow. review scope decisions with your Epic team to ensure that you account for interdependencies between features. As an example, recruitment BPAs don't typically affect other workflows, while billing for research charges depends on the visit registration workflow and potentially the ordering workflow. You'll need more detailed analysis to determine the specific scope related to those workflows. Once you've decided your project scope, be sure you're involving all of the right people to support the necessary changes. You'll need key leaders and champions to be involved in your project to help make decisions, align decisions with policy, and to champion the change that happens as you roll out research tools. As you go through the project, there will be several decision points that will be critical to the success of the implementation of research. You can work with your Epic representatives to help identify those key decisions and make sure that your leadership and staff are well prepared. You can then work with your research governance structure to help answer those key questions, or create a governance structure if you're new to research. In addition to the operational contacts who will be your key leaders for the project, you'll also need resources from across your organization to help with configuration, training, and support. Most organizations identify research analysts who are focused specifically on research functionality and who can work with these key subject matter experts to make decisions about workflows. Additionally, most organizations identify liaisons who they can pull in for specific expertise. This can include expertise in other applications that research touches often, like Beacon or billing, as well as expertise in other areas of your organization, like the legal or compliance teams. We strongly recommend that your research analysts get certified in the research application. This ensures that the research team is knowledgeable about supporting research. Note that there's a separate certification for research billing, which you should also consider having someone take. If you're curious about your current use of research functionality, you can check the Research Gold Stars section in Nova. Align opportunities here with the drivers we talked about earlier to make a plan for where you want to go next. If you're interested in more in-depth information about the functionality in any of these Gold Stars items, reach out to your research TS. And finally, if you'd like to learn more about the latest enhancements, we have a monthly upgrade advice webinar where we discuss implementing functionality from the 2 most recent releases. When the next iteration is scheduled, you'll be able to register for it on the user web, or alternately, you can watch a recording of the most recent webinar there as well. And thank you all for joining us today. We'll leave our contact info here for anyone who wants to contact us outside of the webinar. Otherwise, feel free to stick around for a few minutes if you have questions now. All right, not seeing anything come into the Q&A or chat, so I think we'll go ahead and close out the webinar. Thanks all.